Are you getting the voice?
हाँ बीच बीच में
Okay.
थोड़ी कट रही है, थोड़ा सा बीच में.
All right.
Now I can hear you more.
All right. I welcome you for this very, very important session and very relevant session today. First of all, I would request our Secretary General, Mr. Jaideep Govind, to give opening remarks. Thank you.
Okay.
Thank you, RK, and welcome to Dr. Trehan. Dr. Saab, I spoke to you yesterday, and I'm very thankful that at such short notice, you agreed to tell and talk to our audience. The entire office of the NHRC, our honorable chairperson and the honorable members are also listening. They'll also like to hear as much as the entire staff on the COVID situation and how should the staff and the officers protect themselves. So nobody better than you. And we are all looking forward to this discussion and dialogue. We all know that the problem, this pandemic that is happening in Delhi and in the country is very wide. And the figures as on today indicate almost 2.6 lakhs as the number of patients. There are 7,500 deaths, and quite a few of them have recovered also, almost 1.3 lakhs. So how to save ourselves, how to prevent ourselves, and we have complaints of some of our own employees in the Human Rights Commission. We are a staff of about 500 people, and quite a few are connected today, but we'll also we'll be recording this meeting and showing it and showcasing it to everybody else over a period of time, and to all the other agencies, our core group members, various states, and other agencies who come in contact with the NHRC. So with this preface, I welcome you once again, and I request Khandelwal once again to give a brief outline and information on your resume. Khandelwal.
Thank you, sir. Just to give a brief biodata of Dr. Naresh Trehan. Dr. Naresh Trehan is an Indian national. He is a renowned cardiovascular and cardiothoracic surgeon. He is a graduate from King George Medical College and subsequently trained and practiced at New York University Medical Center, Manhattan, USA from 1971 to 1988, where he obtained a diploma from the American Board of Surgery and the American Board of Cardiothoracic Surgery. At present, Dr. Trehan is the chairman and managing director and chief cardiac surgeon, Medanta the Medici, a 1,500-bedded multi-super specialty institute. Dr. Trehan founded the Scott's Heart Institute and Research Center, where he was the executive director. Escorts were conceptualized, created, and managed by Dr. Trehan from November 1987 to May 2007. To add to his things, Dr. Trehan has received many prestigious awards, including the Padma Shri, the Padma Bhushan Award presented by the Government of India. I again welcome you, Dr. Naresh Trehan. Ourselves and our staffs are eagerly waiting for your speech, because as you know, this pandemic has been a source of lot of anxiety, and actually the people are dying. And in India, for the last few days, the rate of growth has been very, very high, approximately 10,000 per day rise. With this, I invite you to join and give your speech. Thank you.
Thank
Dr.
you, sir.
Trehan.
It is indeed a privilege to be people who are actually fighting for human rights, which is a great work in its own self. They actually, with the way we are going through this pandemic, and not only the pandemic, that there are two cyclones, one locust attack, and then to boot it, all the Chinese are knocking at the door. So to keep one mental status intact, one should understand what our country is going through. And every day we see visuals of the labor still being trying to get home and things like that. But also tells us the human spirit of the Indian people, because a lot of them have been helping a lot and in every way possible way. So we are in the middle of this enemy, which is actually storming through the whole world, and the one that we can't see. So there are three parts to it. One is the virus itself. The second, what the government has done and what the medical caregivers are doing and will be required to do. The other thing is the major participation of all this is of the people. So I will go in that sequence so that I can relay to you. You are highly educated people, so you would like to know a few things about the virus. So you've seen a lot on the TV, and you know that this virus, corona, the crown is what is called after, has been around before. There was the SARS, there was the MERS, then the swine flu came, and this one, which we call SARS-2 or COVID-19, has been particularly belligerent. Discovered first in China, and there is whatever controversy there is, whether it was man-made or whether it jumped from animal to man. But the biggest problem that China did was that it hid the story for 4 to 5 weeks. And Wuhan, being the center of China, is a very busy hub for international travelers, business people. They're always there. So in those 4 or 5 weeks, it was carried across the world. Now, the way the virus works, it has, you are seeing the mortality is about 3.5 to 7% of the world. Now, it is that is one part of it, that it is more dangerous than what we are used to as common flu or swine flu. But the more dangerous part about this virus is the RO factor, which we say is how many people does it, one person who's infected infects. So it's about the level of 3. So that means that one person who gets it will infect 3, and 3 will go on to infect another 3, 9, and then 27. So it multiplies in a mathematical progression. And that is why it has spread so fast around the world. Now, what happened? So what this virus is, it first enters the body through either the nasal passage or the oral cavity. That means that when somebody has the virus, when they cough or sneeze or even talk, droplets of mucus come out which carry the virus, and if somebody inhales it in enough quantity, then they will get it, and it will reside in the upper airway tract. The way we can tell right now is for the 2, 3 days, 4 days, it multiplies in the upper respiratory tract. That's why people get cough, cold, throat pain. It's not necessary everybody will get that, but this is one of the common symptoms. Then it multiplies and multiplies and then goes down into the respiratory tract, into the lungs. So the way it attacks the body is, you see those spikes on the ball that you see in the TV images, that's known as S protein. That spike is made out of S protein, which actually goes and looks at the ACE2 receptor, which is normal in our body. It is needed to regulate our blood pressure, our kidney function and all that. And in that receptor, it goes and engages in the port. It docks, much like you see in space where the space station docking takes place, exactly like that. Then it multiplies from there and then spreads, explodes. That is why it affects the lungs so badly, because it multiplies very fast. Now, initially we thought that the deaths or the lack of oxygen was the reason why it was causing the death, and it was destroying lung tissue. But about 4 weeks ago, Italians, the doctors over there, against the advice of WHO, did 50 autopsies on patients who had passed away from corona infection. In those, they found that there was less destruction of the lung tissue, but there was clotting in the arteries that supply blood to the lungs, which actually exchanges the oxygen. So there was this diffuse intravascular coagulopathy, and that was because of the inflammation that is caused in the body by the body's attempt to fight the virus. That is known as the cytokine storm. That cytokine storm inflames everything on its way in an effort to kill the virus. And then the damage done by that inflammation is that the arteries get inflamed and the blood clots. So that's the mechanism in which it affects the body. It's important to understand it for how treatments are being designed today, because this is the pathophysiology of the virus and the disease. Then we have to come next to the fact that today statistics show around the world also that 80-85% of the people will have a mild form or be asymptomatic and run through it and recover. It's the last 15% or so who will get a more serious problem. And those 15% are the ones who will out of those, majority of them will require hospitalization, may require some oxygenation, will require some treatment from us, but they would recover. About 20% of those will be required to be in the ICU. And in the ICU will be the people who are there, will 50% may require a ventilator, and then 50% who go on the ventilator may not make it. That's the statistics that we have right now. So you're saying, like you said earlier, that the acceleration has already happened. The number of cases reported are already to the level of 10,000. But because we are testing on a limited basis, we don't know the exact numbers, and they may be accelerating at 20,000-30,000 a day. That's very possible. So needless to say, it is spreading very rapidly, and there's hardly anybody who has either in the family or in extended family, somebody or the other. So now, what did the government do? The government, having sensed that this was spreading too fast, and India has a population of 1.3 billion, that unless we break the chain, we will have a very early peak and maybe devastation, which we are not prepared for. So rightfully so, the lockdown was made, and it has been extended, and now it's 70 days or whatever. The thing that happened in this lockdown period, especially in the first 4 to 5 weeks, that we realized that we did not have the infrastructure to take care of patients if people got sick. So it gave the medical fraternity and the government a chance to actually build up the reserve for these beds, and get enough ventilators made and enough PPEs made, which I must compliment the Indian ingenuity that our industry actually repurposed itself very quickly and started providing all these services. So then we are, say, now prepared. But prepared is a relative term. When it becomes rampant, any amount of preparation may not be good enough, like what happened in New York, right now happening in Mumbai. Delhi is teetering on it already. Then what happens is that these people, then you have to start triaging. It happened in UK also. That if people who are 80 years old, 75, 80, 85 years old, they said, we don't have the ventilators to waste on these people, they may die anyway. So there was a whole lot of human misery that was caused by this whole pandemic, which is at our door today. So around the country, we have quite a bit of facilities available. Protocols have been refined today, and I'll go over it with you just now, is that if somebody gets an infection and is mild or mild or no symptoms, then they can be housed in what we call either a COVID care facility or at home. If they can do home isolation and that requires a number of rooms in your house, somebody is able to actually take care of you and all that. So that is one protocol that if somebody gets it, we may advise that you stay home if you have the prerequisite facilities, give the protocol to the caregiver, and also have a package for monitoring at home so that our people will call and or you can call if there's any question mark 24/7 and be able to take care of any symptoms that may be developing. And if we think that it's getting to be any dangerous territory, we would say, please come to the hospital or go to the nearest. That's all downstream. The second one that I mentioned was the COVID care facility. What we have done is around the city and around the country actually is to take hotels which were lying empty, repurpose them to be able to take care of isolating the COVID patients in there and a medical monitoring in there. If they have any problems, then they can be moved to the hospital. So that's the second possibility. The third is that somebody is getting very high fever, prolonged days, does not have the facilities at home, is getting his oxygen level is falling, or getting a cough or shortness of breath, they need to come into the hospital. So if we follow this strategy, we still have a lot of capacity to take care of people. So only the ones who need to be in the hospital should be in the hospital. And if they need intensive care, there are intensive care, we have enough ventilators and all, that we can take care of them. And like I said, only 1 or 2% of them, of the whole population who gets infected, maybe 2.5, will actually not survive. So what has happened in the meantime? Let me come to the treatment part. So initially, there are three ways of now trying to treat this. One is that you do block the virus from talking with the ACE2 receptor. There is some observational studies, and including the 14 Italians we got, they were the first patients that were created, were sent to us by the government, and we took care of them, and we noticed that out of the 14, 11 were taking statins for lowering your cholesterol. Now, statin also blocks that receptor, and we found that 11 of them recovered very fast. Out of the rest of the 3 who were not, they got sicker. 2 of them went on a ventilator, 1 recovered, and one 78-year-old lady did not make it. She had heart disease from before, asthma, and all that stuff. So that is the typical form of people who lose their life. So that was one line of defense. We thought that if it can be, and then the thought was that hydroxychloroquine may be an antiviral effect, and maybe it will help in the early stages. So that's what was being tried. It's still being tried, although the studies are not very encouraging in favor of hydroxychloroquine. Then we took off the shelf many of the antivirals which had been used before for SARS and MERS and all in an attempt to reduce the viral load. And the third thing we said was, if this is causing the cytokine storm, what we call, is causing the damage of inflaming the whole area and the blood clotting, we should do anti-inflammatory and anticoagulants. So after the study, this is now the regime that we follow. And if somebody is getting infection in the lungs, we give antibiotics also. But it has made recovery better because of the fact that we now know that the ultimate last mechanism is the clotting of the blood. So time, the fact that it arrived in India a little later than some of the other countries, have given us more knowledge to fight with it than existed before. Okay. Then we say, okay, what should we do now? You hear the banner, you've got to learn to live with it, because we know that the vaccine, which is possibly the ultimate way of dealing with it, is still 6, 8, 10 months, 12 months away. We don't know. But there are some lead candidates who are promising that they will be on the market by October, November, December. So there are 2 candidates, lead candidates we call them. One is Before I go to the vaccine, let me just tell you about remdesivir, because all of you must have heard about it. It's an antiviral drug which was on the shelf. The Gilead, who repurposed that for COVID-19, is known as remdesivir. Remdesivir, the initial trials have been encouraging, not a cure, but encouraging in shortening the period of the disease and maybe saving some lives. So remdesivir is an antiviral which is found to be effective. The good part is that they licensed 4 Indian companies. So this is part of your field, that on humanitarian grounds, they have given voluntary license to 4 Indian companies, Jubilant, Cipla, and etc., to manufacture it in India so that it's available to Indians when it's on the market, which is expected to be somewhere end of June, first week of July, that we will be able to get it at a reasonable cost because it's being manufactured in India and it can be manufactured in large quantities by these 4 companies. So that is one hope that this antiviral medicine which is available may help us. And let's jump back to vaccine. So as I was telling you that there are 2 ways of vaccine. One is to what we call the traditional method of attenuating the virus, means making the virus weak in the laboratory and then injecting it into a human being so that the human beings don't get infected, but the body makes antibodies to that foreign protein. That's one approach, and the Oxford group is the leader in that. They are now into phase 2, end of phase 2. They will go into more phase 3 trials, and if that works in the next 3 to 4 months, it will be available. But that is also a good thing for India because the Oxford group has licensed the Serum Institute in Pune, which is the largest manufacturers of vaccine in the world, to be able, they are working with them that in case this works out well, that we will again have large doses of vaccine available at a reasonable cost. So that's the second approach that has been taken by a company known as Medanta in Boston, is to say, we don't give the virus, we just make the antibodies in the lab and we inject the antibodies into a human being because that will go and fight the virus. So these are all the approaches taking, but no matter which one succeeds or both succeeds or maybe there are many other candidates, it will take at least 6 to 8 months, maybe longer. So that's where the treatment part is concerned. Now let me come to the most important part. How do we deal with it? So I'm saying, do not take this thing that we have to work, we have to live with the virus, so we just give up and say, let's see, whatever happens, happens. That's not the attitude that should be taken. So along with the war that we are fighting by taking care of patients, I must admire and I will say that the doctors and the nurses, paramedics, the police, all have been working really in tandem, government, private together, although you hear some controversy in the news, that they are the ones who are the frontline warriors and are at risk. So in spite of that, I have not seen any negativity in that. People are still there, they're fighting, they believe it's our war. So we are intact. But now the most important part of this whole puzzle is the public. And that's where one must know that do not live with the virus, learn to cope with the virus. And the cope with the virus has only 3 mantras, as we've all gone blue in the face saying it, but we still see people somewhere not following. So I'll give you the history, it will take 2 more minutes, of why we say hand hygiene, distancing, and masking. It was found out, like when a person who has the infection is coughing, sneezing, or talking loudly, these droplets come out, and if there was one person who's infected and the other one is not infected, and they are within 3 feet of each other, and the contact is 15 minutes or more, the chances of the non-infected person catching the disease is very high. If the person who's infected is wearing a mask, and the other person who is non-infected is not wearing a mask, and they are still within 3 feet, and the contact is 15 minutes or more, then those chances, that high chance becomes medium. If both of them are wearing a mask, and they are still within 3 feet of each other, and the contact is more than 15 minutes, then it becomes minimal. So if that is the case, this has been studied many times. If that is the case, we say if everybody should wear a mask, they should be more than 3 feet, preferably 6 feet away from each other, and the contact should be less than 15 minutes or as little as possible. 1 or 2 minutes is okay. So that's the reason why we give the masking situation. Why we talk about hand hygiene is that when somebody coughs who has the disease and is not wearing a mask, those droplets will fall on a surface near them. Somebody sneezes, your computer, everything will get infected. So we are saying do not touch surfaces if you don't have to. And if you do, then just sanitize your hands. But in any way, wash your hands 4 to 5 times a day. The reason being that if you wash your hands 4 or 5 times a day for 20 seconds, then the concentration of the virus, even if it was there, will become less and maybe non-infected. The surfaces, if you clean them, even if the virus was there, can become less infected. So these are defense mechanisms, that is of hand hygiene and masking. Now, distancing, I told you, more than 3 feet, the droplets don't travel. So if you maintain these things, the chances of getting infection from a person who is infected will become minuscule. The moment we violate these, it starts climbing. So just be conscious around yourself. You're working, I see most of you look like you're at work, that when people come into the room, just put up your mask. If you're alone in the room, that's fine. Keep the air circulation in your room as high as is possible. You can have air conditioning, but on the highest level so that the air moves. It doesn't have to be cold, but if the air moves, the fan should be on the highest level. If you have central air conditioning, please tell them to make it at the highest level of air circulation, because that dilutes the virus even if it comes out of somebody. So close contact, okay, so that's at work now. So you're saying if you have open offices, try to keep the desks at least 4 feet apart. There should be only one person at the desk and all of them should be masked. You know, still I find, I mean, it's a rule in the hospital that everybody and every employee, no matter what their function is, has to wear a mask. In some areas, N95, some areas double mask, some areas just the surgical mask. Either way, that's the best you can do for yourself, and not be taking it out, taking it down when you're talking. It should be above the nose. When what I find is people still become careless. They sit in the dining room and eat, and then they get jumped from one table to the other, although we have made all the tables separate. So these are, that Indian bonhomie is still with us. But this behavior we need to change. So no hugging, no shaking hands, no going near each other. If we can practice this, then hopefully you'll be safe. Because it's no fun getting it, even knowing the fact that there is a 97% chance you'll survive. But still, it takes its toll. So better to protect yourself, your family, and at the large community. So that's, I think, sort of, I can talk about it for days, but I think this should have done. But I'm sure there are some questions. I'll be happy to answer.
Thank you, Dr. Trehan. I think you have given a very good awareness about the causes, prevention, and I think that everybody is very much worried what is going to happen, the final treatment or the preventive vaccine. And in fact, many times on WhatsApp or otherwise in news also, we are finding that some vaccine is being developed in the Italy or in Oxford somewhere. They are talking about the bubble distancing instead of social distancing. Now, I request my honorable members, honorable chairperson, in case if they have any questions, queries, or any observation, I request them to say a few words. Otherwise, we will take up other officials who would like to ask.
Yeah, can hello.
Honorable member Jyotika Kalra. Please.
Yeah. Dr. Trehan, I'm a member of the Human Rights Commission. Hello.
I can hear you, although it breaks a little bit.
Okay,
Go ahead.
okay. My first concern is about social distancing. Density of population in many areas in our country, especially the slums, etc. We can talk about it, but it's not practically possible. And secondly, about again, I am on that point of slum areas where the toilets are common or the public. A lot of people use toilets. So that itself cannot resolve. I mean, we can say ideally we should have a social distancing 6 feet ki duri, 6 foot ki duri. But practically, we must also take into consideration the slums, the density of population we have in urban lives. So when we say this, 2 gaj ki duri, then we should also say where it is impossible. People living in one room, people living in one room, hundreds sharing the same toilet. Have a window for that situation also. And Dr. Trehan, my second concern is about testing. As we are seeing in Delhi, the number of testings is reducing, and out of those tests, the positive cases are it's high. It clearly shows that the testing was less, the number of positive cases are high. So, Paul, that as possible, testing should be very known people. I have been trying for them. It is not easy to get. I mean, it is you can't get the test easily and so these are 2 points. Dr. Trehan.
Yeah, so both these points actually are very, very valid and important. The first lies in your domain that you should demand from our country that we need to give a decent housing to our entire population. That should be our demand. 75 years, we have failed our people. We should not do it anymore. So that, no question, but that is organization like yours can bring it up front all the time. The second, so you're right that the disease will spread hugely in clusters because it's not possible 5 people living in a 10-foot room, it's impossible for all of them not to get infected. But the point basically is those are the issues that have no answers today. So in the long term, when we talk about the new normal, I think that should be the new normal for our priorities. No question about that. So we'll leave that aside today. So we know that those hot zones and hot spots that we talk about will be more so in clusters. In Mumbai, even very posh buildings, the whole entire building got infected. So this, as I said, the RO factor of this virus is pretty strong. And you cannot let your guard down at any point and you help whoever you can help. Now, when we are talking about, like we were discussing, what are the recommendations to fly? What are the recommendations to a bus? Now, we slowly, we have to open up. No question, there is a huge economic misery also that has been a companion of this virus. And we will have to find ways and means to protect as many people as possible. Many people will get sick and slowly get better. So what it means is, from our knowledge, that elderly with comorbidities like diabetes, heart disease, cancer, rheumatoid arthritis, who are chronically ill, they should be protected the most by a family. They should be in a isolation rather than quarantine. Not too many people should meet them. Whoever meets them wears a mask, keeps their distance from them. Those are the things that if we protect them, and it's only the young and able who get infected over a period of time, then that's how herd immunity will develop. Also, in addition to the elderly, you must protect your children who are below the age of 10 because their immunity is not fully developed. So this is what we can do. And I'm saying that this is people's war along with the medical fraternity. People have to fall ill less. So the lesser number of people get infected, the easier it will be for us to take care of the sick. So my appeal is that look, 100% if you follow these three mantras, no matter what religion you are, this is your new dharma. For the time that either herd immunity comes, which will take about 2 years or more, or a vaccine comes, which hopefully will come in the next 6 to 8 months. So I think till that time, we can go back to work, but I'm also coming to work. I can't sit at home. I have never been able to sit back home. We have been working every day. But we take whatever precaution that we can. Even then, some of us will get infected, but that's in line of duty. But for people who have the luxury of maintaining the balance in their life, in their space, in their protection, please do. That's what we can do for us, for each other, for your own family, for the whole community. So but one more thing important. If you get it, does not mean you become a leper. Even leprosy is curable now. So this is curable. Nobody should hide it, because a lot of people are hiding it in their home thinking that they will have a stigma. There's no stigma. Everybody's falling sick. If you look at, there's a report that in one hospital this morning, 400 people have got it. AIMS had the same problem. So this is happening. So if our own fraternity is getting into trouble, when the common person gets into trouble, there should be no stigma. They got it as a virus, an unseen enemy. Is not you don't have a choice. But if you're careless, then you have nobody to blame. That's the whole thing. It's not a disease which carries stigma. That's what I wanted to say. And in your human rights also, it's very important to have that message that it's not a disease which was brought by your actions. Yeah, your carelessness maybe, but it's not like some of the other diseases that we know, which may be coming from unhealthy contact. So the whole idea is that we try to protect ourselves, we protect our people. Our main job, I'll tell you, 30% of my time every day is spent in how to protect our people better, because we know that they're in war. Much like the army does, we have to do the same thing. So I think that if we all, it's like a human chain. If we actually break it, this virus spread, it's be up to us. So one question, I don't know if it's in there, but I'll answer anyway, which is what we call FAQ. The how to take care of people who are quarantined at home or at home, how do they protect themselves? In addition to the three things that I said, it is your immunity which fights the virus. Immunity comes from muscle and exercise. So everybody should exercise, even if you were not exercising before, even if you were a couch potato. Do not be a couch potato today. Be active. So what do you do? Somebody says, I have a small house. What can I do? Yoga, the Surya Namaskar. Even if you haven't done it, start slowly. Exercises the entire body, builds muscle and builds immunity. You take the three exercises, the pranayam, alom valom, kapal bharti, and basarika. These will clean your lungs, will also exercise your upper body and your stomach muscles. So these are things that you can do to protect yourself. Then, of course, we have grandmother recipes of tulsi leaves, haldi, all those things. I have no objection. I am a believer. So no harm if you have a tulsi tree in your house, 5 leaves of tulsi will give you the mental strength. You know, it is, even if it's a placebo, you believe it will protect you, which is important, because your mental state is also very important to fight it. And that's one of the things that we are worried about. We are worried about this stage where it's not only the disease you are afraid of. You and I have a job, but there are many people who are dependent on small businesses closing down. They lose their job, livelihood, families. I mean, I can't imagine what they are going through. And when you see these little children in hot sun being dragged for kilometers and kilometers, I mean, I don't cry frequently, but I have many times in the last few weeks, because of the fact that you can understand the human misery that has been perpetrated by this virus, and that, you know, you can debate policies and all that. I don't know if anybody can do better or not, but the point is, we should help all of them to get home, get the comfort, and then come back if they want to come back, so that this human misery stops. So, any other questions? I'll be happy to answer.
Yeah, we have plethora of questions, but we are trying to limit it.
No, you're okay. You have another 10-15 minutes, no problem.
Yeah. Let me invite Mr. Sunil Arora. He is the joint registrar here. Mr. Sunil Arora.
Good afternoon, doctor.
Good afternoon.
I have a small question on the basis of reporting in social media about medical fraternity denying treatments to kidney patients, persons with serious heart ailments and cancer on account of this COVID-19 onslaught in the country. Would you like to make some comment on this?
No, so you're talking about non-COVID patients who have chronic disease.
Yeah.
I don't know of anybody who's not taking care of them. I'll tell you what happened. In the initial announcement, the very first announcement of the lockdown, it was said in a speech that elective work should stop and the hospital should be empty, in the sense that if COVID came, so what did it do to us? We stopped and there was a lockdown, so people couldn't even move out of their house. So all our hospitals became empty. Our revenue went from to about 15-20%. And as you know, in healthcare, your manpower cost is about 50%, unlike some of the other industries. So we actually have been borrowing money to pay our people, so that we want to keep that army intact. So we do not want to lay off, we don't want to furlough, we don't want to do anything. We want to keep them intact. So if you want to hear our human story, that's the story of private hospitals. But we said that there is no worry about non-COVID patients to come to the hospital, because we opened a COVID hospital separately. In fact, for the first time, an amazing thing happened. 3 competitive hospitals of Gurgaon, that is Medanta, Fortis and Artemis, we got together and adopted a hospital Meteor in Manesar. We voluntarily, without cost to the hospital, we give our manpower, our doctors, supplies to take care of the public. So, but fortunately also Medanta's design is such that we have 2 separate blocks. So if you have COVID, even when we are admitting them, they are in a separate block, and the non-COVID are in a separate block. So our work is going on now. But people couldn't get. People were locked up in the homes. We started saying on the TV that it is safe to come if you need to come. But people who say, I'm sitting in Bihar, how am I going to come? I crossed 3 states, there is no transport. So there was a huge or equal amount of human misery to non-COVID patients. Many patients died at home. They couldn't get dialysis. There are people who had heart attacks who couldn't get to the hospital. So all this happened. But again and again, we are saying there is no fear for a non-COVID person to come for treatment to hospitals who have separate areas completely, which are non-COVID. So, like, you're right that there was a lot of people who lost their lives, but I don't know of any. Maybe I'm not aware of it, that anybody would refuse to treat. Excuse me. Now there is a scare, because when you get COVID patients in your hospital, you always say, to prevent people who are COVID but don't know they are COVID and infecting non-COVID patients, that we insist that we should test them before we take them to surgery. Because if you take somebody to surgery without testing them, the whole team gets infected. The whole OT complex gets infected. So we are cautious. Yes, there is some people say yes, no, whatever. In our view, it's very important that people who are going to take into a operating room, you should have tested them for COVID, so that they are protected. Because if you do it, if somebody's got COVID and you do the surgery, and then they are actually COVID, then it's a double whammy. So that's why, for their protection, for the staff's protection, we should test.
Thank you, Dr. Trehan. Madam Kalra has one more question.
Okay.
Please, Madam Kalra. Madam Kalra. Madam Kalra, please. I think we are not able to connect. Let me take another person. Mr. Alam, he is research officer here.
Okay.
Alam, please continue.
Yes, sir. Good afternoon, sir.
Good afternoon.
First of all, I'd like to thank for all the important information there. Sir, I just wanted to clear some of my doubts that there are rumors that excessive use of sanitizers can cause skin cancers. So, is it true, sir?
There is no evidence. Absolutely not.
Hello?
So basically, what you're saying is it harming your body? We as surgeons are using chemicals all day, sanitize our hands. I mean, I'm now 50 years into surgery. So fortunately, I haven't seen anything yet. But God knows, nothing is really reported. If you've read a report, then I would like to see it.
So another one, I just wanted to know that is it true that the strain of coronavirus spread in India is weaker than US and or Italy?
There is no real proof of that. Yes, what we are seeing is to say that our infection rate is lower or our death rate is lower. Our death rate is, if you look at it, what we know is about 3.5. So it's not, and this is, we have a demographic advantage that more than 50% of our population is below the age of 35. So we should not take comfort in the fact that the virus is becoming weaker, or maybe the sun is killing it. Maybe happening, and BCG may be helping, as you know. But these are all peripherals which do not alter your compulsion to protect yourself and your family and everybody else around. So let it not be any comfort to anybody. Oh, this virus is weaker, so we can be okay. No, I don't think so. I think it's that you have not seen. You have seen. If we have been warning from the very beginning, but if anybody doubted it, today it's true. There are 10,000 cases reported. God knows how many more there are. So
True.
are we actually escaping it? No. This virus is notorious. It can become weak, more muted, whatever. But it is in the normal life cycle of a pandemic or even an epidemic that over a period of time, the same virus gets weaker. And I think it's also that a lot more people develop immunity. So there you say it's not having as much effect. So you will say a year from now. Now that's one of the things that's a good point you've raised. If our population, which is going to get infected and which may be inevitable, comes in waves of 2 weeks, and that's where lockdown helps. That you lock down the hotspots, you keep them locked up. That if it comes in waves, we have enough facilities to handle it. And naturally, 95-98% of them will be already getting the immunity. So what you're saying is it's a staged herd immunity. As long as the peak is not so severe that the medical system gets overwhelmed like happened in New York, which is on the verge of happening in Mumbai. So that's the prayer, if we have any, that okay, if it's going to happen, but please let it happen in a slow progression so that as people get sicker, that many people get better also. So when we are saying today, there are 125 people who have recovered, and there are 250, 60,000 people who are infected. That's what we know. Okay. If you do the math, how is it that the 100,000 have been infected in the last 2 weeks? You get my point. The actual start has been last 2.5, 3 weeks. So there is something mismatch between the data. Because how, if people are getting 10,000 are getting infected today, and there were 500 being infected 6 weeks ago, how have 10,000 gotten better? The balance is off. So we don't know the whole data, but the point is that yes, people are getting better. It's a good thing that we see a lot of mild or asymptomatic disease, and these people can come. Actually, then they become, in a way, superior protection. That now you've already suffered it, you have the antibodies, and you can become the real warriors. When enough doctors and nurses and all these people get infected, they should be in the front line because they are immune. That's
Thank you, Dr. Trehan. Next question by Mr. Dushyant. He is DYSP here. Mr. Dushyant.
Good morning, sir.
good morning.
Sir, I have a very simple question. Actually, we were talking about gaining immunity at home during quarantine. My question is there any actual line of treatment that can be given to a COVID-19 patient at home?
Yes.
Apart from getting immunity, can we have a line of treatment also?
So I'll tell you what we are doing, and the protocols keep changing because as new knowledge comes.
Sure.
Or it is one symptomatic. Symptomatic means if you have fever, you get paracetamol. If you've got a cough, you've got a suppressant, cold. That is all symptomatic. Then we are giving them hydroxychloroquine right now because we are finding it, maybe it's helping people, but only tested positive or people who are taking care of COVID patients, only those. But there is some doubt that it's not helping. But Indian environment with our genetic makeup, maybe it is working because we know it's been in use for so many years against malaria that it may have some effect, and it doesn't have any serious side effects except for heart patients. So you have to get it done under the physician's thing. And then depending on the stage of the disease, they may give you an antiviral along with it. So this is prescribed, like say, I'll give you Medanta's example. We have a full team of doctors 24/7 on call. You have a helpline, you call, you discuss your symptoms, you discuss your space. We'll advise you whether it's safe for you to stay home, whether you should go to COVID care facility or go to the hospital, and what protocol to follow. So it's a 15-day package because that's the recovery, 15 days. So the physicians will call you, discuss with you every few days, but you will be called by the healthcare giver to say, how are you? Is your oxygen okay? Not okay? Because suppose everybody who's at home will require a pulse oximeter to check there, and then we have tied up with a pharmaceutical company to deliver it at home to you. So the medicines and the pulse oximeter can be delivered to you at home, and you can. It's very easy. It's even on the net. You just put it on your finger and it measures your heart rate and your. So what are the symptoms to worry about? If your breathing rate is going up, normal breathing rate is 12 to 15. If it goes up above 20, you are on the borderline already. So that's the time to worry about talking to a physician. If you are feeling shortness of breath or taking a big effort to breathe in, or the lips are turning blue, that's the time to go. If the fever is very high and persistent for 2-3 days and will not respond to paracetamol, that's the time to go. But these are all questions we can answer from a full group 24/7. So there is a home care package. There is that the COVID care facility package, and then there is the hospital. So these are the three things that are there.
Okay, thank you.
Thank you, sir. So kind of you.
Thank you. The next question is by Mr. Joshi from account section. Mr. Joshi, please. Mr. Joshi. I think probably we are not in a position to connect him. We can take the next person, SP Panigrahi from establishment.
सर नमस्कार, मैं एसपी पानीग्राही एडमिन साइड से। जैसे हम ये
नमस्कार।
वगैरह बाजार से लाते हैं तो उसको हर बार कुछ चीजें होती है जो धुल के नहीं रखी जा सकती, जैसे आलू, प्याज और लहसुन वगैरह। बाकी सारे सब्जियों को तो धो के रखते हैं, तो अगर ये बाहर रखा जाए थोड़ी देर धूप वगैरह में रखे तो चलेगा?
हाँ चलेगा, बट इसको ना आप बेकिंग सोडा,
जी
थोड़ा बेकिंग सोडा पानी में डाल के
जी
उसके अंदर 4-5 मिनट के लिए आप डिप कर देंगे तो दैट इज द बेस्ट यू कैन डू।
जी सर।
उसको सुखाना, उसके बाद तो धूप में रख दें, पर
ठीक है
बाकी सब्जियों को भी आपने बेकिंग सोडा में धोना है।
जी।
अंदर पहले तो इमर्स करना है 10-15 मिनट, फिर उसको रनिंग वाटर के अंदर धो दो। तो बेकिंग
वो तो
सोडा
हम
इज
करते हैं।
वेरी हार्मलेस बट वेरी इफेक्टिव अगेंस्ट द वायरस।
ठीक है, ओके सर, धन्यवाद सर।
If I understand right, Deepak ji, your facility, आप फैसिलिटी संभालते हैं, मतलब सारा इंजीनियरिंग आप संभालते हैं। तो अपनी जो एयर कंडीशनिंग की वेलोसिटी है ना, वो जो AHU में होता है फैन, उसको हाई स्पीड पे रखना प्लीज।
जी सर।
हाँ, दैट इज द बेस्ट
ठीक है
प्रोटेक्शन यू कैन गिव। टेम्परेचर को लोअर करने की जरूरत नहीं, वो तो जो कंफर्टेबल है सो है, बट it should be on high the fan of your AHU.
ठीक
Okay,
है
thank you.
धन्यवाद सर।
So are we okay now? So Khandelwal ji, so
Are you able to get my voice?
Yes, we are now hearing you. Go ahead, go ahead. Khandelwal, bolo.
so Khandelwal ji, can I take your leave now?
We have a formal. Formal vote of thanks by Anita Sinha, the Joint Secretary. Anita, can you please?
Yes, sir. So here I am, sir. Uh, Thank you, Dr. Trehan, for taking time from your busy schedule and your speech to us. It was very informative and useful, and this will help us in facing the exigencies. Actually, when we see WhatsApp messages. There are so many messages. We don't know what is right, what is wrong. They create so much of confusion. But hearing from an expert is so assuring and gives us more confidence. So thank you once again, sir, for taking time off busy schedule and giving us this lecture. I also thank the honorable members who have joined for this meeting. The senior officer, our Secretary General, at his initiative, we have taken this step, set up this webinar, and also the technical staff. Thank you all for joining for this informative lecture on COVID. Thank you so much, Dr. Trehan, once again.
No, I enjoyed it. Give my regards to Justice Datu. So all the best to all of you. Nowadays we say stay well, stay safe.
Thank you. Thank you very much.
Thank you, Dr. Trehan.
Thank you, sir. Thank you.